Hello, my name is Makenzi Currie. I'm the BRPS Public School Nurse, and today I'm going to do a video on hand washing. So hand washing is one of the most important ways that we can prevent the spread of disease, illness, any kind of germs, and it is the preferred method over hand sanitizer. So definitely we always want to try to pick hand washing over hand sanitizer. Hand sanitizer is only to be used if that is the only available option you have at the time. So we're going to go over hand washing. So the first thing I like to do when I am going into a bathroom or wherever to wash my hands is I kind of look and I see that my paper towel is already pulled out. That's great. If it's not pulled out, I want to do that first. I'm just going to like push it down or whatever kind of method you need to get a little bit sticking out. And then I first turn the water on. And then I get my soap. And I try to get at least one hand wet. I can get both hands wet. And if I do that and I need more soap, I'm just going to get a little bit more soap. And you want to lather with friction. That's one of the most important things. Lather with friction. It's not necessarily the heat of the water, it's the friction. You are scrubbing the germs off. And I have little kids and I teach them, we do tops and bottoms and in-betweens, and don't forget your thumbs. A lot of times people forget their thumbs. If you have trouble washing your hands for a long enough period of time, you can sing the happy birthday song 2 times through. So after I'm really lathering my hands for about 20 seconds, and I kind of scratch the palms of my hands to get under those nails. I try to keep my nails short because bacteria can live under there, but if they're not, I kind of go through each one and just make sure it's clean. So I've scrubbed them really good, tops, bottoms, in between, don't forget the thumb, and then I rinse them off with the water. And then I kind of try, if you notice, I try to have the water or my hands kind of like this, like down. I don't, but either way is fine. And then you grab, before you shut off the water, you grab your towel, paper towel. Sorry, I'm not a lot of room. Grab your paper towel, and then you take, I kind of take an extra one typically, and then I use that paper towel to shut off the water, because if I touch it with my clean hands, my hands will now be dirty again. And so then I take my, I'm going to pick up my other droppings, I'm going to take it, and if I had to open a door at this point to get out of the room, I would use this paper towel to open the door. Let's pretend this is a door going out. And then once I'm open, and out the door, I kind of use my elbows and my back to get out the door, and then I can just toss the paper towel in the trash. And that is a proper way to wash your hands. Public schools. Today I'm going to talk to you guys about how to properly use hand sanitizer and when to use hand sanitizer. So hand sanitizer is the method we use if that's all we have available. So if we're not in an area that we can wash our hands with soap and water, but we still need to clean our hands and get the germs off, then we use hand sanitizer. If you ever have the choice between hand sanitizer and between washing your hands is definitely the preferred method. There are multiple studies to show and validate that washing your hands with regular old soap and water is much more efficient at getting off the germs. But there are lots of times in our day-to-day that we don't have access to a sink and to soap. So throughout the schools, all the schools, there are plenty of hand sanitizers. Some hand sanitizers are on the wall like this. Some hand sanitizers are in bottles like this. There's all different types. But the concept is the same no matter which type of sanitizer you're using. So just go ahead and put at least one squirt in there. Sometimes a squirt doesn't get a full amount out. That looks pretty good. But if not, just put another squirt on your hand. Take the hand sanitizer just like you would soap and wash your hands together. Just like I talk about in the hand washing video, you want to do tops, bottoms, in-betweens. Don't forget your thumbs. You can scratch your palms like I like to do, but you need to do it until your hands are dry, which is also the equivalent of about 20 seconds. So my hands are dry now. Once they're dry, they're sanitized, okay? Same concept if we were to use this squirt bottle. You just put a squirt on, you take the bottle and you rub it in until it is all the way rubbed in, tops, bottoms, in betweens. Try to get all surfaces of your hands, and then you just rub until they are dry. That is the key point. Rub the hand sanitizer in until they're dry, which is approximately about 20 seconds. Okay, also one more thing, if you are getting hand sanitizer, like if you're lined up, just make sure you're keeping that appropriate 6 feet distance between you. And if you're washing your hands, another expert tip would be to keep the water on. If we have a line of people going, have that first person turn the water on, leave the water on so that you don't have to all touch the handles to the sink to recontaminate. So just leave that water on until the whole line is through, and that's just another tip. Video on how to properly sneeze or cough. There's going to be plenty of times throughout the school year you get a tickle in your throat or tickle in your nose and you'll have to sneeze or cough. There are a couple ways that you can help the germs of your sneeze or cough not go everywhere. Okay, so what you want to do is if you have a tissue, take your tissue and sneeze or cough into the tissue. And then once you're done sneezing or coughing, throw that tissue away and wash your hands or sanitize immediately, okay? And if you have to walk somewhere, walk through a door to get to a hand sanitizer or a sink with soap, then just make sure your hands are dirty now because they touched that Kleenex where you sneeze. So just keep your hands kind of like this and push through a door to try to get through to make sure you're not getting all your sneeze or coughing germs on that door handle. If you don't have access to a Kleenex, then what I want you to do is sneeze or cough into your elbow, okay? So sneeze or cough into your elbow. We don't want you just sneezing with nothing or coughing with nothing if possible. I mean, things happen, but if at all possible, try to cover your cough or sneeze with your elbow or a Kleenex, and then just wash or sanitize your hands when you're done. The other thing I want to talk about, a lot of times we'll be having a mask on. If you have your mask on and you cough or sneeze with your mask on and it gets wet at all, if there's any moisture, you need to take that mask off. That mask is now dirty and I don't want you rebreathing in those germs, that moisture, that air. It's just not good for you to rebreathe. So should you cough or sneeze into your mask, please put a different mask on. So I recommend that each student has about 5 masks, 5 to 7 masks for the week. And they can be reusable, but at least keep 2 to 3 per day just in case that happens. You may not need them, you may be good with 1 mask throughout the day, but if you just have a couple extras, that way you don't have to worry about should you cough, sneeze, get it wet, or drop it on the ground and get something gross or dirty on it. You don't want to put that back on because masks can be helpful, but they can definitely also increase the amount of germs that you're giving yourself if it's not properly worn, if it is moist or wet, or if you are dropping it on the ground or on different surfaces that are dirty. We don't want to put more germs on our body than we had already had. So those are my tips for sneezing and coughing. Okay, so I'm now going to do a video on how to properly wear a mask and how to properly take off and put on a mask. So when you're getting ready to put your mask on, if you are able, you will not always be able to wash or hand sanitize your hands prior, but if you're able, wash your hands first, hand sanitize first your hands if you're able for hand sanitizing, scrubbing your hands together for at least 20 seconds if possible. If you're not able to, that's okay, but just if you have the option, please try to wash your hands or hand sanitize prior. So then, I have clean hands now. I'm going to pick up the mask by the string on the side, and there's all different types of masks, but this is just what I'm going to go over. Pick up it by the side. The side facing you currently is the side I'm going to put on my face, so that's the side that I want to keep as clean as possible. I don't want germs touching my face. I don't want germs touching my skin. So I then take it with the other hand and I put it directly, I kind of make it wide like this, and I put it right over my nose and my chin and behind my ears. And then we want to make sure that it's covering your nose and your chin. This is not a proper way to wear a mask. This is not a proper way to wear a mask. So if you have a mask on, please keep it over your mouth and your nose. You want it to be fitting, but not too tight, because if it's too tight, you can't breathe. It will get wet, it will get moisture in there, which just decreases the protection that you have. So this is how you properly wear a mask. If you need to take a mask off, you will be having to take a mask on and off throughout the day multiple times. Again, if you're able to hand sanitize or wash your hands first, please do. But I realize that's not going to be doable every time by any means. So if you can't do it, just grab the straps around your ears, take it off like this. And then if you're just going to take a drink or something, you can either hold it out to the side like this, take a drink, or if you're taking it off, let's say to eat, then just keep in mind which side is the clean side. I'm going to call it the clean side because I want that side to stay as germ-free as possible. So that would be the side that is touching your face. So you want to take it and you want to fold it in so that the side that was touching your face is folding on itself. So you fold it in. So this outside portion is the side that you would see on the outside. So fold it in, and then you can lay it down. If you want, you can fold it once more and lay it down. But that way, whatever the portion that's on your face or on your skin, the portion that you're rebreathing, is staying as clean as possible. We're not having it. See, that what I don't want you to do is when you take your mask off, just throw it. See, that part's dirty. Somebody could have put their boogers there, could have dropped on the floor. Like, that's gross. I don't want to put that on anymore. Okay? So really, very important to when you're taking your mask off, think about what side was on your face. This side was on the face. I want to keep it nice and clean. So try to fold it in and then put it wherever you're storing it. Whether it's on a hook, whether it's on the table like so, or if you do need to put it in your pocket, We try to avoid the pocket, but if you have to, just make sure it's folded like so.